Good morning, everyone. I'm Hazel Cheesman. I'm Deputy Chief Executive of ASH. Welcome to this start of the week and webinar on raising the age of sale from 18 to 21. We're really pleased this morning to have three really fantastic speakers. So I'm not going to do too much of an introduction so that we have plenty of time to hear from them and to hear your questions. As people are trickling into the webinar, I'm just going to do a few bits of housekeeping. So this is going to be recorded. We'll be making the recording available after the event, so you can share with colleagues, people who you think may find it interesting, or watch it again if there's anything you particularly want to catch up on. All the panellists, if you can keep yourself muted and turn off your webcams unless you're presenting, and be warned, we will mute anyone who doesn't mute themselves. Obviously, the whole point of today is for people to raise the questions that they have about this new area of policy. And so we're really keen to hear questions from people. I'm judging by our webinars in the past, where we often don't get to all the questions, but we do try really hard to respond to those questions after the event if we haven't responded to them in the event. But to ask a question, you can use the question tab, if you just go back, on the right-hand side of the screen in the webinar toolbar. It's on the right-hand of my screen anyway. And type your questions in there, and we'll be collating them and putting them to the panel at the end. If you just move on to the next slide, Effie. This is our agenda. So I'm just going to say a few words, and then we're going to hear from Dr. Emma Beard about the impact of raising the age of sale. Then we'll go on to hear from Kate Pike around the specific issues on enforcement. And then John McClurey from the North East, who's both a retailer and a local councillor. John and I will have a bit of a conversation about the retailer perspective on all of this, and then we'll hopefully leave us with plenty of time to hear your questions at the end. And because I will join the panel for the Q&A, Robbie is going to facilitate the Q&A session, because I cannot ask questions and answer them at the same time. I'm not that talented. So I just wanted to say a few words of context before we move into Emma's presentation. So this is a really live issue, the question of whether we should raise the age of sale from 18 to 21. ASH has been exploring it as a policy for a number of years. Many organisations have supported a consultation on raising the age of sale, most particularly in the was it January 2019 statement, the roadmap to a smoke-free 2030. And then the APPG on smoking and health included the policy in their more recent report this summer. Many of you will know that amendments have been tabled to the Health and Care Bill. They were tabled at committee stage around this policy and a range of other measures. And though the amendment on age of sale and others are being retabled and will be debated on the 23rd of November in the Commons, and if not successful, then we'll move, and if successful, would move to the House of Lords and be tabled again there and debated there. So this is an issue that is firmly on the table, and today is an opportunity for us to really understand why and what the questions would be. One of the things that people have raised is, you know, that 18 is a kind of age of majority. I think that's the way it's sometimes described. But of course, we've had many different ages of consent for all sorts of different things, and they change very often over time in history, depending on our understanding of what the impact would be. And ages of consent and ages of sale go up and they go down, depending on our understanding of that. So I think I'd like people to keep in mind is that there's nothing particularly magic about the age of 18. So really what we're looking at here is what would be the impact of taking this policy forward, and how can we address any and mitigate any possible risks from that policy. So rather than preempt it too much, I will hand over to Dr. Emma Beard. So Emma is Principal Research Fellow at UCL and has been working with ASH and the All-Party Parliamentary Group, looking particularly at the impact of this policy. So I'll hand over to you, Emma.
Oh, thank you. I just need to make my screen a bit smaller with my camera. There we go. So in this presentation, I will overview the reasons for increasing the age of sale, the evidence in support. So it's not clicking. The evidence in support of a rise in the age of sale, and we'll also present some modelling that we did at UCL showing the likely impact in England of increasing the age of sale to 21. I will then finish by highlighting some additional benefits not covered by the modelling, and I'll note that now the modelling that we did was on those aged 18 to 20, so those currently who would be affected where tobacco is legal and it would become not legal to purchase. The majority of smokers start smoking at a very young age, in England an average age of 16 years, and this is one of the reasons for the original increase in the age of sale. From 16 to 18 in England in October 2007. The argument is that increasing the age of sale to 21, and so therefore extending restrictions to those 18, 19 and 20 years of age, would actually make the process of obtaining cigarettes more difficult for younger age groups, both via social sources, so obviously friends or older teenagers and young adults, but also through purchasing. There is also an argument that a decrease in peer use by older teenagers may make smoking less socially desirable to younger individuals. In a recent paper, we actually reported that increasing the legal age of sale to 21 would currently target almost immediately 364,000 smokers aged 18 to 20. And these smokers actually tended to be from more disadvantaged backgrounds than older smokers and non-smokers, suggesting that the change in law may actually help to reduce inequalities in health. So what is the evidence for increasing the age of sale from 16 to 18 in England? And this was in October 2007, because obviously this would give us some indication of what the impact might therefore be for increasing from 18 to 21. Well, there is evidence that increasing the age of sale from 16 to 18 in England had a significant impact on uptake of smoking. A study in 2010 found an immediate 30% reduction in smoking prevalence among those aged 16 to 17. Well, another study in 2011 confirmed that increasing the legal age of sale was associated with reduced regular smoking among youth. Importantly, the impact was similar across socio-demographic groups. So although we find that those who are smoking and are younger are more likely to be from lower socioeconomic backgrounds, the impact of these increasing the age of sale actually appears to be similar across these socio-demographic groups. Recently, we conducted a study in the UCL Tobacco and Alcohol Research Group using data up until 2018. So this is 10 years after the implementation of the increase in age of sale. And we found evidence that the increase in the legal age of sale was actually associated with long-term declines in ever smoking among those aged 16 to 17. And ever smoking was used as an indicator of the uptake of cigarettes. And this was compared to older age groups. So not only do we find a short-term impact, but this impact feeds through in following years. What is the support for increasing the age of sale to 21? So this is really important because obviously we need it to be supported. There is support in the US with around 70% of adults being for increasing the age of sale to 21. And in England, the annual ASH-funded YouGov survey on over 10,000 adults reported that 63% of adults supported increasing the age of sale, with only 15% opposing. Now, importantly, support for tobacco regulations actually grows after measures are implemented, particularly among smokers, and we may believe that this would be the case at the age of sale. So, for example, in 2015, after the law was passed on prohibiting smoking in cars carrying children, but before it was implemented, only 40% of smokers supported the legislation. A year later, after it had come into effect, it was supported by 74% of smokers. Several surveys have also found growing support among small retailers, and this is really important because obviously we need the retailers to be on board. What is the evidence for increasing the age of sale from 18 to 21 in the US? So several US states have already increased the age of sale from 18 to 21, and we can use that data to kind of infer what might happen in the UK, but obviously recognizing that the regulatory system is very different for tobacco in the two countries. So a report by the US Institute of Medicine strongly concluded that increasing the tobacco age would significantly reduce the number of adolescents and young adults who start smoking, reducing smoking obviously related deaths, and also immediately improve the health of adolescents, young adults, and also importantly, young mothers who would be deterred from smoking, as well as the impact on their children. So there's certain groups that might also be highly impacted, and also the concept of kind of secondhand smoking. As of January 2019, 6 US states, so this included California, New Jersey, Massachusetts, Oregon, Hawaii, and Maine, had already raised the tobacco age of sale to 21. And using these states with data before the implementation after, evidence was found that the increase in age of sale had a similar effect to increasing the age of sale in England from 16 to 18, so about a 30% reduction in smoking prevalence. So recently we actually modelled the likely impact that increasing the age of sale from 18 to 21 might have within England. The estimates on the next slide, which I provide, are based on several assumptions, and we use data from the Office for National Statistics, Cancer Research UK, and the Smoking Toolkit study, which is a population level survey of adults aged 16 plus. The first assumption is that there are roughly 364,000 young smokers aged 18 to 20 in England, a prevalence of around 16%, and around 2.5% take up smoking each year, which is around 59,000. Smoking prevalence, we assumed, has been declining over the past few years at a rate of 0.5%, and we assumed that that would continue at this rate up until 2030. Now, just to state here, we acknowledge that the assumption that this would continue at a similar rate is rather optimistic, as this was preceded by several tobacco control policies, including plain packaging and restrictions on pack size, and earlier policies such as smoke-free and the point-of-sale ban. So in our modelling, we found or estimated that increasing the age of sale from 18 to 21 would lead to an estimated 95,000 fewer smokers in 2022, assuming it was implemented at the start of that year, and an additional 77,000 fewer smokers long-term until 2030 in the 18 to 20 age group. So this would reduce smoking prevalence among 18 to 20-year-olds to 2% in 2030, compared to 9.6% if it wasn't implemented. So this is a 7.6 percentage point reduction in smoking prevalence. So we can see here that it has a significant or estimated significant impact. Now, there's several other potential benefits, and we didn't take all of these into account in the modelling, and this is one of the limitations of the assumptions of the models that I will just go over. So the modelling was based on a number of assumptions, as I said. For example, the immediate impact was on reduction on uptake and cessation, but we only modelled the longer-term impact conservatively on uptake. The modelling also did not account for indirect effects, such as re-engaging the public of all ages in anti-smoking messages, or consider the impact on those outside of the 18 to 20 age range in terms of cessation and uptake. Raising the age of sale should further decrease the number of under 18s and even under 16s smoking by making it harder for children to obtain cigarettes and taking legal purchase of cigarettes beyond school age. So the likely impact over the entire population will be much greater than we model here. Smoking is obviously a contagious habit, and the age of sale increase will protect children from exposure to older pupils in schools who smoke and whose behaviour they may want to imitate. The gap will also remove a potential source of supply within schools, and increasing the age of sale also provides an important educational opportunity to actually communicate the serious risk to young people that if you start smoking, you will find it very difficult to stop. So 2/3 who actually try smoking go on to become daily smokers. And of every 3 young smokers, only 1 will quit, and 1 of those remaining smokers would die of tobacco-related cancers. Finally, it will allow engagement with institutions providing higher education to those over the age of 18 regarding prevention approaches, and will target high-risk groups such as pregnant women who are significantly more likely to report smoking at the booking system, particularly those who are younger than older. And as we are all aware, smoking during pregnancy is the leading modifiable risk factor for poor birth outcomes, including stillbirth, miscarriage, and sudden infant death. And younger mothers are also significantly less likely to quit smoking during pregnancy. There will obviously also be additional impacts on those with severe mental health problems, for whom, if increasing the legal age for which cigarettes can be purchased to 21, there will also be an impact there, and other disadvantaged groups. Okay, that's the end of my presentation. Thank you for listening, and I look forward to answering any questions at the end. For further details, I'm more than happy for you to email me, but you can also access all of the modelling that I spoke about today on the Open Science Framework.
Thanks, Emma. And when we circulate the slides and the recording, I will circulate a link to the modelling as well. I think it would be useful for people to see the detail of what you were presenting. And thank you for sticking so excellently to time. I remind people to pop their questions for Emma and for the rest of the panel in the question tab. And I will introduce Kate. Kate is the Regional Coordinator for Trading Standards in the North West and is going to talk through what some of the issues are that people have raised around possible challenges for enforcing this change in the law, and mitigations. So I'll hand over to you then, Kate.
Oh, thanks very much, Hazel. I can not see anybody. I'm hoping you can all see my screen and you can hear my voice. Is that
we can, right? Kate, we can see the slides and hear you and see you.
Oh, okay, lovely. Thank you. So I'm going to talk about some of the issues around enforcement of a rise in the age of sale. We've been talking about this for a little while now as a possible opportunity to help protect young people from the harms of smoking, as well as sort of older people, as outlined by Emma. Raising the age of sale is not about criminalising smoking. It's not about criminalising young people. It's about restricting the access and making it illegal to sell to or procure on behalf of young people under the age of 21. It's really important to recognise that. As Emma's outlined, the academic research, the evidence from other countries shows that the rise in the age of sale will help to delay that smoking initiation and reduce that smoking prevalence and ultimately save lives. It's not just a whim, and we therefore need to look at how we could make it work. Looking at guidance on enforcing age restrictions generally, we can come to the Age Restricted Products and Services Framework, which was drawn up by the what it was known as the Better Regulation Delivery Office at the time. The reason being to draw up that framework around age restricted products is that they exist to protect the health, safety and well-being of young people, not to make life difficult for enforcers, not to make life difficult for retailers, but very clearly to protect the health, safety and well-being of young people. And as I say, we can see that from Emma's presentation that this would be a clear objective of the increase in age of sale. There are no specific ages in the framework. The framework doesn't suggest that 18 is the best age, 16, 13, 21, 30. There are no specific ages in the framework. However, there are specific responsibilities for enforcers, and they are: to be clear about objectives. We mentioned before that we need to be very clear with the retail population, with the general public, what the purpose of increasing the age of sale is, that it's to save lives. It's not, as I say, to make life difficult, it's about saving lives. And that's the really important thing that we would need to make clear. We need to be transparent about what we're doing, you know, not to introduce an age of sale and then pretend that, you know, not enforce it or to keep it hidden in any way. We need to take an evidence-based approach locally. So we would work on intelligence, and I'll come on to that in a little bit in a minute. We'd work in partnership with businesses and communities, not just come up with something that the communities don't want. It's really clear from ASH research, from academic research, that the public support this. So we would be working in partnership with them to introduce the age of sale and to maintain that age of sale of 21. We need to be intelligence-led and not complaint-led. I often have colleagues, trading standards colleagues, say to me, "Oh, we're not doing any age restriction work. We're not doing any test purchasing. We're not doing any enforcement of age of sale because we haven't got any intelligence." Well, actually, I would dispute that. I would say you may not have complaints, but there is generally always intelligence. In the Northwest, over the last 15, 16 years, we've carried out a survey of young people every 2 years, and that survey really clearly says that young people buy cigarettes from shops under the age of 18. So although it's going down and all the amount of children smoking is going down, they are still buying from shops. So we know that retailers are still selling to children. We know that that's an issue. In virtually every local authority in the Northwest, and I'm sure right across the country, there are areas where young people smoke, and that's intelligence. You know, that intelligence is not just around a complaint, although obviously complaints are an important part of intelligence. All of the responsibilities outlined in the framework are possible with an age of sale of 21. I'm going to come on and talk about some of the challenges that have been put to us when we've been considering a possible increase in the age of sale. These are, and I'm sure you might have others, and please do feel free to raise them, because it's really important we address them now while we're considering developing this policy and putting this policy forward to government, that we consider what challenges we might face. The first one is around retailer confusion, burden on business. You know, we should have a consistent age for everything, and then it would be much simpler. The second one is about the cost and the resource of educating and enforcing with local retailers, and that's a burden on local authorities, which obviously with the reduction in numbers and resource, we would have to address. We've been asked if Challenge 25 is considered best practice for an age of sale of 18. Should we increase the Challenge 28? It's a very, very good, valid question. And as always, the bugbear of any policy, any tobacco policy, anything that's ever considered for a change in regulation to protect young people, to increase the number of quitters, the reaction is always, oh, there'll be an increase in illicit tobacco. So those are the challenges. Let's address those. So the first one is about retailer confusion and the burden of business. And you know, John and Hazel, I'm sure will discuss this, but it's actually a little bit patronizing to suggest that retailers can't deal with different legislative requirements. They are clear, you know, they clearly have to anyway. So suggesting that they can't cope with different legislative requirements is, you know, is insulting really, and not fair, because they already do that. Best practice will apply in every case. Age verification checks will be important. They can still carry out those whether somebody is 20 or 17. At the moment, best practice would include Challenge 21, Challenge 25. Challenge 21 obviously would no longer be relevant. Challenge 25 would be very relevant. Staff training is really important, explaining, as I mentioned before, the purpose of the change and the reasoning behind it. That's really important so that staff are aware. Using till prompts, technology is obviously developing all the time and will be really helpful to anybody who's selling the product to enable them to support the to comply with the law. Store layout, signage and CCTV, that is obviously best practice for age-restricted sales generally. Store layout, possibly less so, because for tobacco, obviously we still need to keep it behind a closed display. So whether that's behind the cashier or under the till, that's up to the shop, but you know, they still need to be kept there. Signage, obviously we have a mandatory age of sale sign, which we would need to amend slightly, but that's not, you know, not rocket science. CCTV can always be really useful for retailers who sell age-restricted products. Keeping and maintaining a refusals register, again, best practice. I think one thing to remember is that tobacco is the single most dangerous product on the market if used exactly as the manufacturer intends. And as Emma mentioned, it will kill 1 in 2 of long-term users. It's not, it's therefore our responsibility as enforcers, it's retailers' responsibility to ensure that those products are not sold willy-nilly. And it's really, really important that we take into account that we're selling a dangerous product, and that therefore regulation is really important around that. So there will be a cost, a resource for education and enforcement, which, you know, could be seen as a burden on local authorities. However, the impact assessment will be really important with this. We need to ensure that the impact assessment fully addresses the additional costs. For example, when the age of sale of the nicotine inhaling products, e-cigarettes, was introduced, there was new burdens funding attached to that, along with the Tobacco Products Directive, of over £500,000 a year for 3 years for local authorities in England. So, you know, significant amount of money. But the thing to remember, of course, is that new burdens funding then goes into the local authority, with the local authority making the decision on how that's used. But that's up to local authorities based on local needs. If local authorities want to use that for something completely different, that's their choice, but it's available, and it does enable us to fund the resource that we may need. But there's also an opportunity to consider the sanctions and possible opportunities to streamline the system. We're currently, as you know, looking at the new sanctions for illicit tobacco sales being developed by HMRC that are attached to the track and trace system. Those proposals are for significant financial penalties for selling illicit tobacco, but they're civil penalties, and possibly that's something we could consider for age of sale non-compliance. Again, these things would need to be addressed, but it's not something to dismiss straight away. It's something that we need to consider. As I say, the issue around Challenge 28, if Challenge 25 is best practice with an age of sale of 18, should we increase the Challenge 28? Well, that's a possibility. We would propose that an introduction or an increase in the age of sale to 21 would go along with consideration of a proposal to introduce the Scottish mandatory age verification policy. So in Scotland, retailers must have a system in place to ask for ID from anyone who appears to be under 25 who wants to buy tobacco. They can set the minimum age at a higher level if they wish. They could say anybody who looks under 30, anybody who looks under 40. Not having a system in place that they can show an enforcement officer that they're using is a breach of the regulations and incurs a fine. Now, that's something that we could definitely consider. Even if we didn't increase the age of sale, that is a policy that would help to ensure that age of sale restrictions are complied with. And then illicit tobacco. Illicit tobacco is the absolute favoured argument of the tobacco industry and those who work to promote the tobacco industry. And every single time there is a change in regulation or a proposal to introduce regulation to protect children from tobacco or to improve quitting, illicit tobacco will come along as the argument. Every single time the duty and the tax is increased on cigarettes, again, because that's the most powerful tobacco policy to reduce smoking prevalence, is to increase the price. Again, the argument is always illicit, the epidemic of illicit. So I always like this slide, which is really important. This is from the HMRC figures. Now, this is the year 2000, and you can see that 17 billion illicit cigarettes were consumed in the year 2000. And here we are down in 2020 when it's gone down to 2.5 billion. And you can see how that's decreased over time. That's decreased over time while the price has gone up from under £4 for a packet of 20 to over £11 for a packet of 20. So despite whatever the industry loves to roll out every single time, the price has gone up and the amount of illicit tobacco consumed has gone down. Now, don't get me wrong, 2.5 billion illicit sticks is still an issue. That's still 700 million illicit cigarettes smoked every day. We've still got a job to do around illicit tobacco, and we are continuing to contribute to that that whole strategy through things like Operation CC and other work that we do to tackle illicit tobacco. But it has decreased despite that argument. Not only has it decreased while the price has gone up, you can see there standardized packaging was introduced, and you can see and you will remember the huge amount of publicity at the time that said illicit tobacco will increase. Now you can see that it hasn't. And if you look at this next slide, again, you can see that when the age of sale increased from 16 to 18, again, the argument was illicit tobacco will increase. And you can see that's not been the case. Illicit tobacco consumed has decreased over that period. And there is no reason to think it would not continue to decrease with all the work that we're doing in partnership to reduce illicit tobacco, despite the increase in age of sale. So I'll just wrap up now. To summarize, is it proportionate? Well, yes, it's going to save a significant number of lives. Is it workable? Well, yes, of course it is. Is it supported? we've already heard that it's supported by the public, by retailers. So yes, it is. And as you can see from the change in the mandatory sign, it's easily possible to change that mandatory sign to say that it's illegal to sell products to the age under the age of 21, although I don't think I'm going to be getting a job as a graphic designer anytime soon. And thank you very much for listening, and happy to take any questions in the Q&A.
Thanks, Kate. I like the idea of you getting your Sharpie out and going around the Northwest, amending all the signs.
I'll do that.
Thank you. That was a great presentation, really interesting. I'm sure that there'll be lots of questions off the back of that. Do add them into the question bar, and we will move on to a chat between myself and John, if I can ask John to join me, and FA to pop some slides up on the screen. Hi, John.
Hello, Hazel.
I shall introduce you while we wait for FA to share the slides, or to tell me I need to share them. So John, you have, I think, been working with Fresh in the Northeast and with Ash for, goodness, quite a few years now. And you both are a retailer yourself, but also a local councillor in Gateshead. Have I got any of that wrong?
The last bit, I actually stood down from the council at the last election. Just so busy, so many things to do. I'd done 13 years and I felt, time to move on.
Done you a bit. Can you tell us a bit about your shops? You have more than one, I think.
Yeah, no, we now only have one. The original shop was on over 40 years. Was demolished and we closed that one, so we just have one busy shop in Newcastle now. So I'm just a relatively normal small retailer. Continue, selling everything. Try to do what we can to do as good a job as possible. So.
Shall I? I'm going to share a couple of slides from a survey that we did in 2019. So FA, if you could flick on to the next slide for me. So this is a survey that we did, as I say, in 2019. It was just shy of 560 retailers from across the country, undertaken over the phone. And you can see there the kind of mixture of different kinds of retailers, the bulk of which are sort of in the kind of convenience store space. That's how they describe themselves. So if you put the next slide up, FA. So before we go and talk about the specific support around age of sale and other policies, I thought it would be helpful, John, just get your perspective on how the relationship between tobacco and retailers is changing over time. So there are two graphs here. So one which says 75% of retailers agreed that selling tobacco was important to their business because people bought another product at the same time. And then another, the second graph there saying that 71% saying they didn't make that much profit off of a pack of cigarettes. And I guess those two things can be true at the same time, that it could be a footfall product as well as be something that individually isn't just kind of stimulating an awful amount of profit. And I think that's often what we hear from retailers, that that's their kind of view of what tobacco is. It's something that brings people into the shop. But I'm very grateful to academics from north of the border in Scotland. I've forgotten the exact institutions, I should apologise, but the link is there. So they've done a recent bit of analysis looking at data from EPOS systems and showing this sort of drop in tobacco sales, the number of baskets that contain tobacco sales of 47%. So it's clearly a kind of product on decline as a footfall driver. John, how does that reflect your experience of selling tobacco?
Yeah, certainly, we do sell a lot of tobacco, we continue to sell it. From our point of view, it tends to be an individual purchase. The customer will come in and buy 20 cigarettes and that's it, they will leave. I know we did some work a few years back where we looked at, like related selling and basket selling, and there wasn't that much of it. It tends to be a customer comes in, will buy the cigarettes and will leave. We don't make a lot of money percentage-wise on cigarettes, but obviously we do make money. But it is no way critical to my business to continue selling the cigarettes that I sell. About a third of our turnover is from cigarettes, but a much smaller percentage of my profits, which I'm happy I will share. I haven't got the figures to hand, but if somebody really wants to know, I can provide that data.
So from your point of view, purely with your kind of retailer hat on, it would be preferable if your customers stopped purchasing cigarettes and started purchasing almost anything else that you sell in your shop.
Yeah, I mean, I've been known over the years for my coats, the birthday card one and things. And I did some work down in Parliament, and I had a packet of cigarettes and a packet of chewing gum. And at that time, it was a packet of 10 cigarettes going back. But I made more profit for my business in pence out of that packet of chewing gum than I did out of that packet of cigarettes. So if somebody stops smoking and buys a packet of chewing gum instead, I am actually better off. My turnover comes down, but my overall profit increases, and it certainly doesn't drop off. And a lot of retailers are beginning to understand that now, I think, and they're more pragmatic about it. And as long as we've got customers coming in, then we'll find something to sell them.
Yeah, it's no skin off your nose what you're selling them. If we move to the next slide, FA. So this is sort of to the point about the relationship that tobacco companies have to retailers. So we asked retailers if they felt the tobacco industry had the best interests of retailers like them at heart. Under 40% agreed. A similar number agree as disagree. So 38% agree, 36% disagree. And there's quite a high level of contact back in 2019 between tobacco industry reps and shops. I wonder that may well have changed through COVID, but in the last 6 months, well over half have been visited by reps either weekly or monthly, and then over half have their tobacco gantry paid for. Then we asked them what kind of things that they've been talking about with their tobacco industry reps, and they talked about what brands they've been stocking, and this is between 40% and 57% sort of said that noted one of these things that they discussed with tobacco industry. So what brands they should be promoting, how they could avoid selling to children, stocking e-cigarette brands, where e-cigarette brands should be positioned. And then here we get into a bit more of the kind of policy side. So standardized packaging, which was perhaps more front of mind back in 2019, illegal counterfeit tobacco, and then implications of new tracking and tracing regulations. So this is quite a kind of involved relationship, it seems to me, John, between retailers and tobacco industry reps. I'm going to guess, after all the years of work that you've done in collaboration with us and others, that maybe you're not top of the tobacco industry Christmas card list.
Yeah, you could safely say that, yes. I mean, my gantry, which they would normally have refurbished to make it legal, they decided to give me instead, and that was, but they were doing it for all of the major retailers. But I mean, we were selling then probably £6,000–7,000 of cigarettes a week, and I had to spend £100 of my own money to make my gantry compliant, not the £12,000 that they suggested it was going to cost, and we've had no problems with it. But yeah, I did see a cigarette rep just after the budget. That's the first one I've seen this year, and I just don't see them. If I do see them, they know of me, and they know what my point of view is, and they don't tend to do it.
What sort of impact do you think, John? What sort of impact does having somebody come in and talk to people regularly about these policy issues? How do you think that might shape the views of retailers?
It does tremendously. I mean, until I got involved again with the local council, which led to my work with Ash, the only people I ever spoke to about cigarettes were tobacco reps, and you only ever saw one side of the argument. And the same with the trade press, who were the independent voice of retailing, who were anything but. So you only ever heard one side. And I remember talking with Peter Wright from Gateshead. When I first got in the council, there was a presentation about the display ban. I think it's display ban. And I explained that, the facts and figures I was seeing for the first time. because everything else I'd been fed was coming from, had a vested interest in making sure that the regulations didn't change. And I'd always questioned it, but I couldn't find out anything. So you do speak to the reps, and they're very personable, and they might be encouraging you to buy something, or they were, and then, there was enhancements or inducements to stock new lines. So they obviously had your business in, they were nice people, they were doing their job well. That was what they meant to do, and they wouldn't tell you lies. But things change.
Well, I think that context is quite helpful if we move on to the next slide, FA. So here is a sort of outline of, we asked them about a range of questions. I've just put a few up here, and their level of support for action on tobacco from retailers is actually, despite that context of, the drip, drip, drip from the tobacco industry, it's not vastly different from the public. So, a big majority, 77% support larger fines for breaking the law, 78% strength. These are things that have potential to have direct impact on people's businesses as well, in terms of having to change practice. Strengthening of challenge 25 schemes, and a license for tobacco retailers. 84% is so popular among retailers. I think it's a similar proportion of the public also support that rule. And then the one we're talking about today, increasing the age of sale from 18 to 21, as Emma already alluded to, over half of retailers supporting this, and that slightly lower than the general population, but not vastly. And the other thing I wanted to reflect on is we asked about existing policies and the extent to which people felt they impacted on their businesses. It strikes me, John, that one of the reasons that retailers perhaps are not as hostile to changes in tobacco regulation is they've seen a lot of them over time, and maybe they are, they see that they don't actually enormously impact on their business. So here we have standardized, has it impacted on your business? Neither positive nor negative is in the bar there. So standardized packaging, 67% didn't impact on their business. Prohibiting tobacco displays when people physically had to change those displays themselves, in the case of John and others, but not everybody. And 70% no impact. Restriction on display of prices, no impact. Age of sale of e-cigarettes of 18, again relevant to this discussion, 78% said no impact. So John, what, from your point of view, you're a retailer, why is it that you are comfortable supporting a rise in age of sale from 18 to 21?
Sorry, Hazel, could you just say that last bit again, because you were breaking up, at least for me.
Why, from your perspective as a retailer, why are you comfortable supporting a raise in age of sale from 18 to 21?
Personally, I think, like a lot of retailers, we understand that smoking ain't good for you, and the harder you can make it, or the more obstacles you can put in the way for kids to start smoking, the better it is. And one thing I would say, with we got all these figures for support for action from within retail. You probably, those 77 and 78, 84% are the law-abiding retailers who do the job properly, and see themselves undermined by whether it be illicit tobacco or shops that aren't doing what you would hope they were going to do, and that is a way that it make it more of a level playing field for the retailers. Nothing worse than refusing a sale to someone and then 5 minutes later they're walking past smoking a cigarette. So,
and at the end of the day, retailers, particularly these independent retailers like you, John, you're at the heart of your community. You're part of your community, and and are therefore invested in it. And so protecting that community is kind of part of that. I don't know if you can hear me, John. You look a bit.
Yeah, for some reason, Hazel, you're breaking up. I don't know whether it's at my end or your end, but maybe now is a good time
to move to the Q&A anyway, because we've got to the end of these slides and we want to make sure we've got time for people's questions. So if I can ask the other panelists to turn their cameras back on. Thanks, Emma. And Kate will join us in a moment, hopefully. And John, not John, sorry, Robbie, is hopefully going to have looked through some of the questions from people. Robbie, over to you.
Yeah, okay. Have we got everyone with us? I think we,
yeah,
sorry, just pulling up my cameras. Yeah, so we'll dive straight into it in that case. Hazel, I might actually come to you first with this. You were talking about it a bit at the start of the webinar, but kind of returning to that concept of the age of 18, how can increasing the age of sale for tobacco be justified as, well, a move from 18 to 21? How can that be justified if that's kind of the age that children are considered to reach adulthood, and particularly in the context of, you know, pressure to kind of decrease that age in other areas like voting, kind of moving from 18 down to 16? Is that going to be a challenge, and how can that kind of be justified in that context?
Thanks, Robbie. I think that is a really crucial question, the kind of ethics of it all. And I'll go back to what I said at the beginning. I think there's nothing magic about the age of 18. And the fact that we're having debates about whether we lower, for example, the voting age, or we might, you know, be looking at moving things in different directions. You think about what we've done over time around the age of consent for sex. These things have changed over time, and there is nothing magic about the age of 18. And what we need to do is to have regulations that fit the evidence that we have around harms and benefits. And clearly from the presentation that we had from Emma today, there is an enormous potential to divert young people from a lifetime of regret and harm from consuming tobacco by raising the age of sale. And therefore, we are justified in exploring you know, raising this particular measure from 18 to 21. I mean, it really wasn't that long ago that it was at 16, and moving it from 16 to 18 may have been controversial then, but has been very straightforward to implement. Emma, would you add anything to that?
Yeah, I think also kind of behaviourally, we find that smoking initiation and then going into being a regular smoker, this actually doesn't just take place up to the age of 18, but it's still continuing up into the age of 21. And so smokers who are kind of 18, 19 years of age tend to have a lower dependency than older smokers because they haven't quite established the behaviour yet. And so it's still a group that we need to target. And obviously there's the secondary impact when we think about younger children, how they actually access cigarettes. So a lot of younger children get it from kind of 18, 19-year-olds, students, etc. And so, I mean, I understand that there's this issue of kind of, and as Hazel's covered it, but I think from a behaviour point of view, they are a group that really do need targeting. And just finally, their motivation actually appears to be much lower than other smokers. And so they actually need, or the idea is that we actually need some of these policies to actually increase their motivation to stop smoking, to get help and not uptake these behaviours.
You are invincible between the ages of 18 and
maybe whilst we're still on that topic, Emma, if I could kind of put to you, often, you know, in kind of data collection and things like that, we'll see the age group is all the way from 16 to 24, and it won't always kind of cut off at that 21 age group. And it is a question we sometimes get as, you know, why stop at 21 and why not go to 24? Or sometimes people will even say, why not go to 25, given we have kind of challenge 25? Can you speak to that a little bit?
Yeah, Hazel might know a little bit more about this, but I think from what I understand is it's a policy that obviously it's going to have an impact on younger adults. And I think it's a big step moving. I mean, I would be very for it going to 24, 25, 26, but I think at 21, it's sort of something that's in the middle of being acceptable, but also having a large impact at this early stage. But I think Hazel probably might have a bit more.
I think it's balancing the impact with the acceptability, as you do with any policy. You know, we can, you know, we can reasonably explore how, and we have the evidence as well from the US, because where they've moved to 21, which I think is pertinent to this discussion. You know, we don't necessarily have evidence for this kind of older age bracket in terms of impact. But yeah, I think we can see the impact on the behavioural side, as Emma says, in terms of uptake, establishing addictions, needing greater motivation in this age range to move people towards quitting behaviours, all of which comes together to make quite a strong case for action. And yes, you could look at an older age group. We have to balance that against what's acceptable in the political arena.
Okay. So John, I might come back to you. We've had quite a few questions in on kind of industry reps and their behaviour. So do you think that, you know, if this was becoming a kind of more significant part of national conversation, or maybe it already has kind of filtered into those conversations, is there likely to be pressure from tobacco industry reps on retailers if these proposals were kind of made more public? Are reps still offering incentives to tobacco retailers? And kind of in the face of all that, how do we kind of best communicate the importance of this policy to retailers and get them on side and kind of counter any of those narratives that might be coming from the industry? I'll start with you, John, and then maybe Kate, you might have something to say on that as well.
Oh, yeah. Okay, thank you, Robbie. Biggest problem I've got answering that question is I don't see cigarette reps anymore. So I'm outside of that field of influence. Certainly, COVID had an effect on cigarette reps, and I had a couple of phone calls from them who were just keeping in touch. So whether there are incentives now, I don't know, but there certainly was. You know, if there was a brand that they were pushing that you didn't have, they would give you free stock to stock it. But what the current situation is, like I say, I don't know. Insofar as getting the message across, all I can think of, you know, we have, you know, people like the News Agents Federation. It may be that somebody's got to go into the Lion's Den, and they have a conference every year. But the opposite, you know, you would normally have somebody from one of the tobacco companies there giving a presentation to tell you how wonderful they are and how, you know, their products don't kill. And, you know, it would be something that we should be looking at as to how we actually speak to people to get a message across, because we haven't got anybody in the field. You know, we've got trading standards out there. Whether they could be given the tools so that they can go in with a pack of, you know, pint of sale, because if I want to challenge a 25 poster, I've got to print it myself. I haven't got a colour printer. So, you know, all the posters I put up are not as dynamic as they could be. And it would be useful if we had, you know, if there was a national store or supply that, you know, people, you know, the trading standards could get hold of, and then they could go around, and that would give them a way to walk into a shop, talk to people who are, you know, running the shop, and say, look, we've got this, you know, that will help you with, you know, the changes that are coming, and it's not going to, it's possibly going to open doors and get a conversation going.
Yeah.
The only way I can think of possibly doing it. I don't think the cigarette reps are going to do it.
Did you have anything to add?
You know,
oh, sorry, go on. You still talking? I know. Did you have anything to add on that, Kate, in terms of getting the message across to retailers? And
so like John, don't think I'm exactly on any Christmas card lists of any of our tobacco industry colleagues. I don't think I'm persona grata. The one thing I would say is most people on the call, I'm sure, will be very familiar with the Framework Convention on Tobacco Control, Article 5.3, which tries to protect public health policies, which this clearly would be, from the influence of the tobacco industry. The guidelines for Article 5.3 are very, very specific, that governments, and that includes local government, should be very wary of any so-called, you know, friendly retailer schemes around underage sales. That age-restricted sales are something to protect from the influence of the tobacco industry, based on evidence from around the world that such schemes are sometimes tarnished and are not really designed to deliver the outcome they should be. So again, very, very cautious. We need to be careful of that. If there's a loophole in a policy, if there's a loophole in regulation, it will be exploited. So we need to be really careful about any regulations that come from such a policy, that they are very carefully written to protect that. So
yeah, no, always a good reminder. We've had a couple of people asking around, if we had an increase in the age of sale for tobacco products from 18 to 21, should we also do the same for kind of nicotine inhaling products like e-cigarettes? Is that something that would naturally follow? Is it something that we should be doing alongside it? Who would like to speak to that? Hazel?
I don't know if others would want to come in. They're welcome to. Certainly, that is not something that we are suggesting. Tobacco is a uniquely harmful product, as we all know, because we're on this webinar. And e-cigarettes do not fall into the same category of harm, and they are clearly a route out of smoking. And if we're raising the age of sale from 18 to 21, and we are asking a group of people to stop smoking, ensuring that they have access to, all the alternatives is important. And so we're certainly not suggesting that the age of sale for e-cigarettes should mirror that of tobacco at this stage, for sure. Emma was nodding, so I'm assuming she.
Yeah, completely agree. Yeah.
Okay, well, that's definitively answered. That's good. Kate, we've had a couple of questions around, you were kind of touching on this earlier, the resource implications of all of this for trading standards, particularly in the context of capacities already being so stretched. Can you say anything to kind of put people's minds at ease around that?
In terms of coming up with a new,
or just in terms of, say, the implications of raising the age of sale, what is that going to have should that come into effect? What implications would that have on enforcement capacity? Is that going to make things even worse for trading standards in your view, or I think it's not to be worried about?
We have a responsibility to enforce the age of sale at the moment. We have no, as I mentioned before, it's really important to look at intelligence and be intelligence-led rather than complaint-led. And if we are complying with our responsibility to enforce the age of sale at the moment, it's just a different age of sale. It's not saying more shops will be impacted or more retailers will be impacted. It's the same number of retailers will be impacted, whatever the age of sale is. So if we are complying with our responsibilities at the moment, we can comply with them in the future. If we're not, we need to consider that. But I think that's a resource issue for trading standards generally, which is a much bigger issue and being addressed by much more important people than me in far bigger forum than this. So.
Okay. No, that's helpful. Thank you. I think we've probably got time for one more question. I'll just say there are a few questions we probably won't get to that have come through the chat, but we'll follow up with the speakers and send around written answers. But what I might finish with, Emma, Hazel, this might be one for you, but Kate and John, do feel free to jump in as well. It's just simply asking, raising the age of sale, is this a priority? Won't it distract from more important issues like funding for tobacco control or those kind of bigger capacity resource questions? So is this the policy we should be going after right now? Hazel, shall I start with you?
I think we have to be led by the modelling that Emma and colleagues did at UCL to support the APPG report, that if we look at the various measures that were being proposed in that report, this is the one that can really bear down on rates of smoking and help us to achieve that 2030 goal in a really substantial way. Yeah, we absolutely need the funding so that we can provide all the services that we need to help people stop smoking, so we can invest in trading standards in a way that we can kind of improve the enforcement side. And though it shouldn't distract from the work that we're doing to achieve a levy on the tobacco industry to resource all of those things. But if we look at the various regulatory things that we could do right now, there are very few other things that would give us the sort of bang for buck that raising the age of sale from 18 to 21 would do. And I would just add before handing over to Emma that we are really encouraging people to endorse the APPG report on smoking, and we'll send a link round to that. Then also, for those of you that are health professionals, public health professionals, there is a letter, which is an open letter going into the BMJ, which you'll be invited to sign up to today to support not just this measure, but the range of measures that are being tabled in the health and care bill to bring up, help us to get us closer to a smoke-free 2030. So it isn't an either or. but age of sale is a really, really important tool in the suite of things that we need to achieve a smoke-free 2030. Emma, do you have anything that you would add?
No, so yeah, I agree. If you have a look at the modelling, you'll see that we model different things, such as a mass media campaign, impact on pregnant smokers of different campaigns, and this had the biggest impact. But obviously, those are also important, and hopefully, some of those will also be implemented. Also, just to say the age of sale as well, the evidence coming out is that from previous increase in the age of sale is that it has an impact across socio-demographic groups, and that's really important because obviously there's this socioeconomic divide with smoking, and obviously it's higher among those from less kind of more disadvantaged backgrounds. So it'd be a really important policy to maybe help tackle some of those social inequalities as well.
Thank you so much to everybody, and thank you, Robbie, for stepping in to do the Q&A at the end there. As Robbie said, we will respond to questions that we haven't got to, and we'll be circulating this recording and the various things that we have been alluding to today. And so thank you to the speakers, and this is an ongoing issue. I'm sure we will come back to it. Maybe we'll have a further webinar further down the line, but thank you for your time, everybody.
Thank you.